And do you know the danger of this? If you don't look for a deeper remedy, many times patients will die. I have lost many patients in my life only because I was not able to identify the chronic constitutional remedy which would have come after the removal of acute symptoms. I'll tell you a case here. I was treating a case of carbo-veg. This case was about acute CCF, or what we call as congestive cardiac failure. All the symptoms of carbo-veg were present. Fanning, hot patient, dullness, coldness, heat, burning. Patients started improving after different potencies of carbo-veg from 30th to 10M. It took me 3 weeks to remove the acute picture of congestive cardiac failure. I was very happy. I was very young at that time, and I was very happy that I could treat the picture solely with the homeopathic medicine. And there were no allopathic drugs that were used for congestive cardiac failure in those days. The patient was staying in a hut, or what we call a H.O.P.E-Homeopathy. So very, very poor patient. And I used to visit that patient and try to observe and give the right remedy. Least did I understood that I have to even understand the chronic picture that will come up. And so after 3 weeks of joys, when I was still continuing carbo-veg, she developed a massive heart attack and she died. And I was always wondering, if case was improving so beautifully, so nicely, why the person died? Answer I got later on when I read the work of Dr. M.L. Dhawale in Principle and Practice of Homeopathy, where the answer was mentioned about identification of chronic layer after initial removal of the acute totality. And since that day, I made it a point that I should always identify chronic layer side by side when I'm giving an acute remedy also. So that has now become a routine practice for me in my clinical practice. This is the best time for constitutional remedy which will prevent relapse. If you don't give constitutional remedies, the relapse will keep on coming regularly. Like let's say some lady will come and say, I develop cystitis every menstrual cycle 10 days before the menstrual cycle. So you give Cantharis, she is much better. What will happen in the next 10 days, next menstrual cycle? Again, the cystitis will come. What will happen in the third cycle? Again, cystitis will come. Like that, you will finish your whole life giving Cantharis. But patient still keeps on getting relapses. Answer to this question is, please give a deeper layer medicine. That is more important. Identify that layer. And then you will definitely be a very successful homeopath, and the relapse of cystitis will not come.